I was just trying to tell him that we're live.
I normally wait until 6:29.
Okay, yeah,
That way it's
spot on.
running on the money.
I'd like to call the meeting to order. Welcome everybody for coming out this evening and joining us. Apologizing for our meeting on Thursday. We were hoping that we were going to be able to continue to have it that evening and waited a couple extra minutes to see if the weather was going to switch, and obviously it did not. So we made the call just to make sure that everybody would be safe and be able to join us this evening if they so chose. We'll jump right into our agenda. Number 3, agenda approval.
Move.
Second.
All in favor? Those opposed? Motion carries. Number 4 is our public comment. Just to explain how this process does work, I have a list that we have had some folks sign up on. We do ask that we could limit comments to 3 minutes. We have several people that are on the list this evening. I just would like to emphasize that these are public comments. We don't typically reply, so if there's any questions or what have you, we usually just will listen, and then once we have our once we have our discussion, we may choose to discuss during that time. So just a little business there, just to let you know how these things are handled. And please allow people to talk and not make comment in the back, so everybody is able to say what they came here to tell us about. The first person on our list is Courtney Casefold. And just to let you know, we do have a few extra mics up here, so just to let you know, you should just still be able to sit down and have your conversation. Welcome.
Thank you all. We appreciate for all the hard work you've been doing over this pandemic. Thank you, guys.
Thank
I'm
you.
grateful for you. I would like to speak to you today from 2 different perspectives. First, as SCEA president, I'm here to represent the members and request that you vote to keep the mask mandate in Scott County schools. Our number 1 goal is to continue in-person instruction. According to WEDCO data, our community is seeing a very high volume of breakthrough cases with Omicron, and our incident rate is at 166. Jefferson County will be using NTI this week due to staffing shortages related to COVID-19. SCEA does not want to be put into this position, therefore we are prepared to utilize the Test to Stay program and hope that you will support the current mask mandate. Also, I would like to speak to you as a mother of 2 children, one of whom is high risk in Scott County schools. As I have watched the past few board meetings, I noticed a lot of emphasis being put on giving students and staff time to be fully vaccinated. I want you to know I appreciate that you have advocated for everyone to have that opportunity. However, we thankfully have more than a vaccine to protect ourselves and others, that being the mask. Some parents have chosen not to vaccinate their children and use the mask as their only tool of protection. I had a parent state that when masks go optional in our schools, she is worried about her kids being bullied or ostracized by peers because they have chosen the mask as their only form of protection and must continue wearing it to stay safe. If masks go optional, the segregation it brings among staff and students is undeniable. With the new Omicron variant being prevalent in Kentucky and spreading so easily, it is imperative that masks be mandatory to protect in-person instruction. School boards cannot mandate vaccinations, but you do have the authority to keep a mandate of a powerful tool of protection, which is a mask. Governor Beshear requested all schools with optional masks to please reconsider due to the Omicron variant. The duty of requiring a mask mandate has been delegated to local school boards. All state and local public health data supports keeping mask mandates for public schools, businesses, and events. And being vaccinated is not enough to protect us from Omicron, COVID, or flu. Per Dr. Stack, the strain this year for flu is the H3N2 strain, which is associated with a little worse disease. Our best form of protection is vaccination and masks, and as a parent, I've searched all forms of public health data, and I have yet to find one that supports optional masking for schools when the local incident rate is critical per state guidelines. Since virtual is currently not an option for parents, I ask that you consider keeping the mask mandate to ensure all students attending our schools can feel safe coming to in-person instruction. My main concern is protecting my children and my students, and my son is high risk. When masks are optional in schools, I cannot think of a career where you could be put at more risk of obtaining COVID-19. What other occupation has this level of exposure? It is hard to find careers that people are exposed to hundreds of non-masked individuals each day, and I appreciate the Test to Stay program. I have used this many times for safety purposes. If I have COVID-19, I want to know quickly before I bring it home to my children or spread the virus to my students. Personally, I could not live with myself knowing I put someone at risk or someone they love at risk. Please consider keeping the mask mandate and not having masks as a topic of discussion at each meeting. The public health data is clear. The discussion of masks during these critical times creates unnecessary anxiety. Thank you all.
Sorry.
We thought you were summing it up, I apologize.
Yeah, that's fine.
I appreciate you taking time to come.
Anyways, yeah, so thank you, I appreciate you.
Thank you, sorry about that. Just a little note, we do, on some occasions, get a little staticky there at the microphone. One of the comments or one of the thoughts was with cell phones being so close to it, it might cause that static. So just kind of keep that in mind too when you come up. Just, I don't want it to kind of squirmish out on us there a little bit. The next person is Anthony Young. Okay. Thank you for joining us.
Thank you, ma'am. I just want to say, as we enter several months into the 2 weeks to slow and stop the spread, it's clear that the masks aren't doing that. We have cases that are, are highest they've ever been now, and it's clear to everybody else that the masks aren't helping. The masks in the schools, they're not helping. Most of our kids don't like them. I know my kids don't like them. When I told them I was going here, they were like grateful and saying thank you for trying to get us to take these masks off. There is no data that supports that these masks are working right now. Specifically, there's health experts right now who are saying that the cloth masks that the kids are wearing at school aren't doing anything anyways. And so unless we're going to mandate KN95 masks and N95 masks, there's really no point in having them. And even if we mandate the N95 masks, there's still kids who can't afford them. Kids who are still going to wear them, they're going to be dirty, they're going to use them for weeks and weeks on time and stuff like that. So I don't know what just wanna ask that you guys make mask optional. Again, as far as kids being ostracized and not, being protected, they still have the option to wear the mask. And if the mask really worked that well, then everybody's gonna be fine, right? So I'm just asking you, please go mask optional. Keep it short, thank you.
Number 3, Mark Griffith. Hello,
Well, thank you.
thank you for joining us.
I just have a few questions and comments. I'd like to know on what authority and law that you could present that states that that masks are mandated and not without an exemption. And all I can find is recommendations from the Department of Education, and all I see is that the federal court upheld that the state has no authority to mandate masks. So why do you have the authority to? And how do you expect us to trust you all when all you do is follow what the government recommends? And most of us don't trust the government. They have been wrong, and they've changed the narrative way too much. They've been wrong about lockdowns, they've been wrong about social distancing, they're wrong about vaccines, and they're constantly changing the narrative because they control the narrative, and we are not allowed to question it, and that is tyranny. You take into consideration that the suicide and depression among youth has skyrocketed. We can't get these times back from our children, and they can't be replaced. It seems selfish to me that we harm the masses to protect the few. And whose responsibility is it to protect the vulnerable? Is it the kids? And I can find numerous studies, including some from the University of Louisville, that masks do very little, if at all, to slow the spread. And they do more damage than good. And even in the mainstream publications, they say there's no effect for Omicron. N95 masks state on the box that they do not protect from virus. They only protect from bodily fluid and bacterial filtration. They're not meant to wear all day and protect you from a virus. And especially the cloth and the silk mask that these kids are wearing, they do nothing. I hate to tell you, but we're all going to get it, and that's a fact. And with that said, the survival rate of kids with confirmed cases is 99.99%. So we quit trying to protect the adults at the sake of these children. And we can protect ourselves. And I'll quote from the University of Southern California College of Pharmacy: the masking of kids as long-term is potentially enormous. Masking is a psychological stressor for children that disrupts learning. Covering the lower half of the face of both the teacher and the pupil reduces the ability to communicate. In particular, children lose the experience of mimicking expressions and is an essential tool of nonverbal communication. Masking exacerbates the chances that a child will experience anxiety and depression, which is already at pandemic levels. Now is that not a pandemic worth dealing with? This has caused my kids to question everything about this, and rightfully so. It's confusing when we live our life normal outside of school. Can you explain to them why we can go play sports, eat, shop, etc. without masks, and why they have to wear masks in school? We now have to get tutoring for my son because he missed kindergarten altogether, and he's fallen behind due to these restrictions that it's holding him back. And what about the 8 states that have banned masking altogether? They seem to be functioning fine, and even better in most cases. The states with the highest vaccination and strictest mask mandates are worse off than we are. And there are lots of private schools in the area that have never done anything and they haven't had to go back. So what's the difference between them and us? And why haven't we done a survey for mask options like we did for school last year to go back to in-person learning? And everyone has had time now to be vaccinated if they choose. It's time to move forward from this. Yes.
I'm sorry.
It's all right. I got plenty more, but thank you. I appreciate it.
Thank you. I hate to interrupt you guys, I really do.
I had 5 minutes.
Dottie Back, excuse me, I'm sorry.
I broke mine for 5 too, so I'll try to go quickly. My children have been in Scott County schools for 10 years, and over the past 10 years, one thing has remained constant. They have been told daily by faculty and staff, you are responsible for your choices and to make good choices. They are not told to be responsible for the choices of their friends, family, teachers, or the general population of Scott County. Why is that? Because we recognize each individual can only be held responsible for what is in their control. They cannot control the choices made by others. According to the CDC's website, the top 3 risk factors for severe complications from COVID are obesity, hypertension, and diabetes. Have you considered the percentage of Scott County COVID positive cases that are people with pre-existing conditions? The latest data from KentuckyHealthFacts.org shows that Scott County has a 37% obesity rate among its adult population as of 2019. Hypertension is at 39%. The diabetes rate in Kentucky adults has more than doubled in the last 18 years. The population of Scott County are not born with these conditions. They are a direct result of adults making poor choices. When considering the mask policy, you are using health department numbers for all of Scott County, therefore making the children of Scott County schools responsible for the choices of the adults in Scott County who have not prioritized their health. As a parent and a member of this community, I want to be part of a viable, sustainable solution. For the last 21 months, masking children for 9 hours a day has been both the beginning and the end of the solutions offered by Scott County schools. What else can we do? Well, you can minimize your risk of COVID-19 infection and its severity by getting adequate vitamin D. This is free and can be done every day. Are we mandating that children go outside for 30 minutes every day and get sunshine and exercise, which would also lower the rate of obesity in Scott County? No, we're not. Are we mandating that kids get exercise at all? No, because in Scott County, after 5th grade, you don't even get recess and PE daily. So kids in middle school and high school are being told to sit still all day and not move. I understand there's a curriculum that has to be taught, but there's also a 30-minute period at both Scott County and Great Crossing High School where the kids, it's called nest and card time. Why are we not utilizing that to encourage the kids to get exercise or vitamin D? Not only are we not encouraging it, we're discouraging it. They're not even allowed to use that time to go to the gym and shoot ball or take a walk outside. The time has come for Scott County schools to practice what it preaches and to stop making students of Scott County responsible for the choices of others. Instead of sitting back and passively implementing a mask mandate, let's make real changes that can have an impact on the health of students, not just now with regard to COVID, but in the future, so they do not become part of the growing obesity population in Scott County. If you want to use COVID cases as a basis for requiring the mask, at the very least, you should be using the case numbers among the student population only. After reviewing the data on the Scott County Schools website, August through December of 2021, even on the day with the highest cases, we still only had 24 positive students. That is 0.00266% of the student population in Scott County. If we make masks optional, we can also not just use the nest time, but we have these mask breaks. They can use that time to take a walk, get some movement in.
Thank you. Laura Sanders. Hello.
Hello. Colleen Rice, who's the district health coordinator, head of all of us school nurses, unfortunately couldn't be here today, so I'm just reading for her. She is the district health coordinator for Scott County Schools, and I'd like to share my concerns on the impact of removing the mask mandate at this time. On average, throughout the pandemic, we have had 10 COVID positive students a day in Scott County schools. There was a time when our numbers were at our lowest that we had 30 COVID positive students in 1 week. Last week, we had over 100 in 2 days we were in school. My concern is not only the negative health impact of positive students in schools with unmasked students and staff, but also the number of quarantines that this would create. Even if we abolish the mask mandate, quarantine rules still exist. With masks, with the exception of shoulder-to-shoulder, all-day partners in elementary schools, we see a small amount of quarantines in the classrooms. Without masks, those numbers will skyrocket. For example, one positive middle school student who attends 7 classes in a day is in contact with 210 students for the 45 to 50-minute classes. A 56% Scott County vaccination rate of those students have been vaccinated within 6 months or boosted, then that would leave us 93 students who would quarantine for one positive case. This does not take into consideration band, choir, sports, and other outside school quarantines. That means our nurses would need to contact over 100 families each time we have a positive student. This is in addition to taking care of the health needs of the rest of the 625 students. That's the average student to nurse acuity in Scott County schools. This includes 38 students with diabetes, 444 students with life-threatening allergies, 536 students with asthma, 79 students with seizures, and numerous other special health care needs. Nurses would also need to track which students and staff are required to mask on day 6 through 10. Find space to isolate the numerous amount of students they will be sending home with symptoms or a positive test, and fill out a mountain of paperwork with each positive case. It is an impossible task. We cannot put this onto our nurses at this time when Scott County has a 122.3% incident rate and a 24.45% state positivity rate. Please take this into consideration when voting on the mask mandate. Thank you for your time in reading my concerns. Sincerely, Colleen Rice.
Lydia Moore. Hello, Lydia.
Good evening. By my estimation, we are now on day 656 into 14 days to flatten the curve. We have shut down businesses, schools, churches, government offices, and even doctors' offices. We have canceled sports and proms and plays and music concerts and seniors' activities. We have social distance and masked like good little boys and girls. Everyone who wants to be vaccinated at this point has had ample opportunity and encouragement, or rather has been coerced, to do so. And yet here we are, almost 2 years later, no better than when this all started. Indeed, worse off, as our liberties and individual rights have been stripped away, all in the name of it's for the greater good. There is no goalpost. It has been torn down and moved down the field so many times, I have lost count. Now is the time to do the courageous thing and stop all of this for the sake of our kids. Stop operating out of fear and start leading our school community back to the normal school experience our kids deserve. I know some of you are concerned that entire classrooms or even schools will be shut down due to quarantining rules. If that is the case, then change the rules. Operate the way we did way back in 2019 with regard to illness and inevitable viruses. People get sick in the winter. Wearing a mask will never change that, as has been evidenced over the last 656 days. If you are waiting to remove the mask mandate until the Scott County School Board eradicates all sickness, then you will never remove the mask mandate. Some of you find great comfort and security in wearing a mask. That's great. You can wear it for the rest of your life if you so choose. You can wear it in the car by yourself when you drive down the road. You can wear it to your table at the restaurant and then pretend that as you eat, you are safe from COVID while your mask is off. I do not care. That is your business. But hear me on this. If you insist that our kids wear these disgusting face diapers for 7 to 8 hours a day in order to keep themselves, teachers, and administrators safe, and you go anywhere without a mask in public in your day-to-day lives, you are a hypocrite or worse. Remove the mask mandate. Let parents decide what is best for their own children. Enough is enough. The time has come to take a stand, and the time is right now.
Dr. Hambrick. Thank you for joining us.
Thank you, members of the school board, and Superintendent Clark for this opportunity. I believe that as a community, we have mutual goals. One of those goals is the safety, well-being, and mental health of our children. And the other goal is to keep our schools open. I believe the only chance we have to do that is with masking. in other cities, New York, Chicago, Atlanta, the debate now is to not whether to mask, but whether to close school down to in-person learning because rates are so high. In Kentucky, we have just called out the National Guard to help with overwhelmed hospitals, and our positivity rate today was 26.3%. Every COVID positive patient further overwhelms an overstretched, exhausted, understaffed, out-of-beds healthcare system. In my practice today, I left, we still had 6 doctors seeing patients. We've seen 26 positive COVID patients today. Last week, we had 90, that was with only 2 days in school, versus our previous record week of 60. A couple of things I think will help you understand what happens when the healthcare system gets clogged up. Just this last week, I wanted to get an emergency CAT scan for a 2-year-old child. For the first time in my 36 years of being a pediatrician here, I was told that we didn't have the ability to do that emergency CAT scan. That's never happened before. It's not an integration of the hospital, it's an explanation for how bad things are. I was in the emergency room on Christmas night. There was a patient in the emergency room who needed intensive care. The closest hospital where he was sent was Pikeville, Kentucky. In the last 8 days, 3 doctors in my practice have become COVID positive. I've had similar numbers of nurses and secretaries become positive. And I think that we are now making contingency plans for how to be able to continue to see all the illness that we need to see. And that will mean that we will have to basically stop doing other vital services of preventive care, vaccinations, etc. At Georgetown's hospital, right now, people are waiting in the emergency room for beds. Surgeries are being canceled, and preventive care is being canceled. I do believe that masks are an inconvenience and a nuisance, but I don't believe that they hurt anybody. I think that we have to continue to change our facts based on change our plans based on the facts of what we are seeing. And right now, in this outpouring pandemic, we are seeing too much to stop masking. It's about like deciding that you want to go swimming really bad and deciding you're going to keep swimming even though you're in the middle of a lightning storm. Thank you.
Thank you. Tina Durham. Hello, Ms. Durham.
Hi, how are you?
Thanks for coming.
Good evening. My name is Tina Durham, and I am a teacher at Ann Mason Elementary. I also have 2 children in the district, so I'm speaking to you not only as a district employee, but also as a parent. I'm coming to ask you to please keep the mask mandate in place for Scott County students, staff, and their families. I know there is much debate about what's right, what's needed, and what's fair, but I would like to focus on the what's fair part. See, I teach social emotional learning here in our district to our students, and I will tell you what I tell them about fair. The fair comes once a year at the fairgrounds each summer, and that's about what fair means. It's not something that we should use to decide whether or not we should do something as adults, or to allow our children to decide whether or not they should be required to do something. I also teach my students that everything worth having in life requires hard work. Math is hard for some, but they still have to do it. PE is hard for some, but they're still expected to take part in it. Others think that school in general is hard for various reasons, yet we still require that they attend school. Finally, I teach my students that life is not about them or me or anyone. There are going to be things that they're going to have to do in life that, quite frankly, they will not like, but that does not give them a pass to not do those things. Now let's tie these things to our current conversation. See, I don't have data. I don't have a lot of the things that most people have been talking about tonight. I'm talking about our students as a population and the things that they are seeing that we as adults are saying and doing regarding this issue. I'm sure many think that requiring us to wear masks is not fair, but we can meet up at the fairgrounds this summer and have that conversation if anybody would like to. As for doing the hard things, wearing a mask for an extended time can be hard. Teaching in a mask is really hard, but watching friends, family, my students' families, or loved ones be in the hospital is way harder. I will take wearing a mask all day over doing that. And finally, this is not about us. Just like I teach my students, it isn't about you or me or what we want or even them. It's about doing a hard thing to protect others. We can go back and forth about COVID until the cows come home, but I would rather be uncomfortable, more so inconvenienced, about wearing a mask until this dies down. I want my students to know that we as adults are setting the example of doing the hard things to help others instead of focusing just on what we want. I want to set the example for them, but I also teach them that it's okay to agree to disagree, and if I don't, quote, get my way tonight, I promise I won't be venting about it on social media. We need to model accepting differences and others' opinions for our students and our children as well. Regardless of what happens tonight, please just remember that all of our students, our kids, are listening. Please vent with caution because I promise they are listening, even when you think that they are not. And more than anything, let's show them how to be kind, no matter the circumstances. Thank you all for your time and good luck tonight. Elizabeth Crossley. Welcome.
Forgive me, my notes are actually on my phone, so there may be a little interference.
Hopefully it'll be okay.
Okay. So, first of all, I want to introduce myself. I've been a registered nurse in a level 1 operating room for 11 years now, in various roles throughout that. So essentially I've been wearing a mask for 11 years of my life. The majority of people do not know how to wear a mask correctly. That includes some of us that wear it all the time, much less our children who can barely tie their shoes, and even our adults. Plus, new recommendations from the organization that I work with has said that cloth masks and even regular procedural masks are no longer acceptable. So it has to be a surgical, an N95, or a KN95. So essentially, our children coming to school in cloth masks is useless. It's pointless. Personally, I don't feel like this is doing any good to prevent the spread. It's probably causing more because your children are touching their face, they're touching others. We've also seen a rise of other illnesses that we really haven't seen in the older children and adults, such as RSV. So my point is, the masks aren't doing anything to protect our children. At some point, we're all going to get COVID. Even those that are vaccinated, it's happening a lot. Even friends of mine that have avoided it for 2 years, vaccinated, boosted, they're getting it. So I think it's just time that we realize that the masks aren't working, they're not doing any good, and just move on.
Thank you. Kathy Younger. Good evening.
Good evening. Like we're on a first name basis. Okay, I have a little different approach, and I just want to share some thoughts before you have your discussion on the mask. First of all, I watched the news tonight, so y'all know, and I know you're concerned about Omicron, the numbers, and I know you don't want to shut the school down, and I don't either, nobody does. But when he made his report today, did y'all happen to hear him say that how many kids were actually in the hospital in the whole state of Kentucky? It was 23. The other thing is the testing. I mean, it's outrageous. I mean, why are people with no symptoms lining up to get tested when they're not sick? And then you got people that are getting a test one day and it's positive and they're saying, I don't think I'm that sick. They get another test, it's negative. So, their test, it's gone, and then the quarantine has gone from 14 days to 5 days. The guidelines change every day. So I got a question. If you're sick, do you go to the doctor? not sick, why do you get tested? I'm saying, I'm not sure we can trust all these tests. So here's my suggestion for the discussion. We used to take temperatures when the kids got to school. And guess what? The ones that were sick were sent home. So if you do that, you're getting the sick kids out of school, and we don't need masks. So I'm just suggesting that you all go back to that and really revisit that. Hire people if you have to. Use the millions of dollars you got from the federal government to buy thermometers and people to take temperatures. So let me be clear, and I know you all are going to agree with me on this. I'm a nana. I'm raising my grandsons, twin freshmen in high school. Been around the block a few times. It was always my theory about school. You don't go to school, you got to have a fever. We've all seen the movies with kids with the thermometer on the lamp. Okay? You got to have a fever, throw up, vomit, or have something really bad wrong where you don't go to school. So, I think we should go back to that. Plus, doctors, and Dr. Hambrick will agree with me, so pediatricians have always told me, that if you're fever-free for 24 hours, you can go back to school, you can go back to work. So my question is, why is COVID any different? Why are we testing people that aren't even sick? I know these are what you're all being told to do, but I'm asking you to think about this. If you're not sick, if you don't have a fever, you're not sick. You know, so what I'm asking is, and the other thing is, this is never ending. You're always going to have a new variant. Now they got the one called what, flu COVID or something, where you have flu and COVID at the same time. Think about it. We've always got another one coming out. So I'm asking, you know, unmask. If there's nobody sick, then unmask.
Michael Tackett. Good evening.
Hello. My name is Michael Tackett. Guess this is working. I'm a lifelong resident here in Scott County. I know most of you all, and been here 43 years. And you know, I care about this community, and I know that you all do. And I know that the people out there care. The ones that are wanting the mask, the ones that aren't wanting the mask. One thing I want to say is, as far as some of the treatment and things that I've heard said about Dr. Hambrick, I think that's disgraceful. And I say that because I've been here my whole life. Dr. Hambrick is one of the most upstanding doctors in the community. He's probably been your all's pediatrician at some point, or your kids, or your grandkids. He's been mine. He's been my sister's. He's been my child. My family's all from here. So, you know, I think there needs to be a level of respect that's brought back in this discussion from you know, those that oppose this. And, you know, because we can have this argument back and forth. As far as what I do, I'm a teacher here at Elkhorn Crossing. And so I've been in the thick of it since that March day, March 13th, where it all started. And I can tell you just from my experience that the numbers that I've seen in my classroom increased after every time we had a break. So, and what happens on a break is on a break, kids get to take their mask off, they go on places, they go around families, they go around friends, and then they come back and they've got symptoms. They're sent to school sometimes with those symptoms, because I've had them in my classroom, where I've been shoulder to shoulder helping a student at some point, and then the very next day find out they were positive for COVID. I've watched more students be absent this semester, this past semester, than I even did during the first wave. And that's concerning because when I got back from Christmas break, I had a dozen students missing out of my program. Now, we service groups of students for 3 hours at a time in a closed-in facility where the 3 classrooms are all together. And so, you know, it's difficult to run a classroom when you have 5, 6, 7, 10 students in a class absent. I want them in school. Folks, it is easier to be in school. Okay, as a teacher, it is easier to be in school. Do I want masks? Nobody wants masks, folks. Nobody wants masks. I don't like them. You all don't like them. But what we want and what we need are 2 different things. Wants and needs are different. And we do need the masks so that we can keep kids in school. Thank you.
Thank you. That concludes our public comment section for this evening. Thank you for everybody for coming and sharing your perspectives. Thank you for all the emails, hundreds of emails that we have received. We do our best to try to reply to everybody, and I want to say thank you for taking time to share your perspectives. They do mean a lot to us, so thank you again. I'm going to go ahead and move right through our agenda. Number 5, approve calendar committee recommendation for the 2022-2023 school year.
Move to approve.
All in favor? Those opposed? Motion carries. Number 6, discussion of mask requirements for Scott County schools. Sure.
So, someone made a comment about the authority that the board has to mandate masks or not. Is it correct that the legislature under SB HB 1 gave that authority to the local boards of education?
That is correct, and it did not dictate which way the board exercised that authority. It said the board exercised its own authority on that. Key, as I've said to many clients and folks over the years, is that you're not arbitrary in how you exercise that authority. You base it on reasonable consideration. Folks might agree, folks might disagree. But are you being reasonable, rational about it? And that being the case, then yes, the General Assembly last year did in September place that authority in the board's hands.
We can't hear.
So I asked, because someone made the comment, who gave the board the right to have, who gave us the authority to say mask or no mask? And the Kentucky State Legislature actually did pass a law that puts that authority in the local school board's hands. Not just masks, but COVID practices, it's more than masks, but that is what gives the local board the authority to do that.
That is Senate Bill, House Bill 1 passed last September. Okay.
Thank you, Josh. Susan or Stephanie, would you like to start? Any conversation?
Well, I mean, to say it's a conundrum would be an understatement. I don't think I've heard a single person say anything that I didn't agree with, and that's the conundrum. Because keeping track, we're about 50-50 in terms of the speakers that were supporting a mask mandate and those that oppose a mask mandate. And I understand the perspectives of every single person that's speaking. No one wants to see these masks go away more than me, as I'm sure anyone that's paid attention to recent board meetings has witnessed. It is a constant challenge to make the right decision for 9,000 children, as you can only imagine, I'm sure, and another huge group of adults that are interacting with them on a daily basis. And it does feel colossally hypocritical to mandate masks for adults and children in our schools, knowing that every other aspect of their life, that's not the case.
Amen.
That being said, I think it's incumbent on us, and it certainly feels that way to me, that our priority has to be to keep schools open. I know, I hear about and then witness to some of the downsides of wearing masks for children every day, which is one of the reasons why I don't like them. I'm not convinced that they're 100% effective in keeping children safe. I don't think anybody is, to be fair, but it is a line of defense. And it's my understanding, and I wanted to ask Mr. Parker to talk about that some tonight, to explain some about how that works in terms of a student who tests positive wearing a mask versus not wearing a mask, and what that does to our quarantine numbers. Because again, my priority is keeping the doors open. I know that there's negative effects for children wearing masks all day, but I believe the effects of going virtual are worse. And I think there's few people who would disagree with that. And so if keeping masks on in the midst of these ridiculously high numbers for another stretch of time affords us the ability to keep our students in a building with adults where they're fed and we know they're safe and they're receiving the better quality education, then that's a sacrifice, as much as I hate to say it, I think I have to be willing to make. And don't think it doesn't pay me to say it. But would you, Mr. Parker, talk a little bit about the Test to Stay program and how that works?
Sure.
And how it differs if we take masks off?
So with the quarantine numbers, you know, you're talking about what our quarantines look like when we've got students that are wearing masks. Am I good? Okay. With students wearing masks. So in an elementary classroom, in a lot of cases, the only people that would be captured in any kind of quarantine might be shoulder partners. Somebody sitting directly next to a student all day long. And not always, but again,
So a child in third grade tests positive for COVID, you're really only looking at, right now, mask mandate in place, at quarantining those people on either side or something.
correct. And in a lot of cases, they don't have somebody on either side.
Sure.
They generally have one, likely on one side or the other. So when that happens, you know, our quarantine numbers have been manageable. I know we came back from break, and the first day back from break, Great Crossing High School didn't finish doing Test to Stay until about 1 p.m. that afternoon, which is far different than what typically had been happening with regard to this. And again, that's not anything to say about what's going on in school, because they weren't at school. As far as quarantines without masks, that captures far more students, and the concerns as far as that goes really is the fact that Test to Stay, you know, is already having difficulty keeping up with the numbers, and then to think that we're going to now be capturing more students in a quarantine, there's no way we'd be able to keep up with that through Test to Stay at this time. And I know, you know, I heard it's been said, you know, hire more people. The workforce shortage does not, it's not limited to any particular industry. Everybody's dealing with it, and our partners with Test to Stay are dealing with it as well. So that would definitely be a challenge.
Well, and that's a concern of mine, because the numbers are going up. In November, December, when we were discussing this, numbers looked much more manageable. It looked like we were coming out on the other side of it, and it was going to be manageable. And, you know, speaking about workforce, it's the concern of capturing people is if we don't have teachers. You know, it's one thing to say, you know, you can't just go out and hire teachers. It doesn't work like that, unfortunately. So,
We can't firm this up.
right, to think that we would put ourselves in a situation right now where we're forcing school to shut down because we have too many teachers or adults captured in quarantine, and then that forces us to put the children back at home and virtual, is, to me, worse than asking our students and our adults to wear masks for another short stretch of time. And that doesn't mean I'm right. I see head shaking, and I understand.
That's okay.
It's just it's a conundrum.
We understand.
It's a conundrum.
Thank you. Stephanie?
I would echo the same sentiments. I mean, you know, I hate this term, it is what it is. But at this point, you know, we can only do so much, and our main focus is to keep kids in school. We have to keep kids in the building. That's where they're safe, that's where we can take care of them, where we know that, you know, learning in person is always the best option. And we have to do what's best for them.
Thank you. Joanna?
So, I agree with that, I think everybody in this room would agree that having kids in the building is what's best for learning, right? I mean, I don't think anybody disagrees with that. And the other piece that I've been thinking a lot about, is, I think Dr. Hambrick spoke about the things that are happening that are putting the stress on our healthcare systems, and we received communication from Dr. Miller about that as well. But if you, and that's, all of that is happening, absolutely, 1,000%. But the other thing one thing I think that we have to look at is what's happening to our systems, right? The main thing is the main thing. We've got to educate our kids, and the best way to do that is keep them in schools. But when you have our staff who are overwhelmed with the test to stay and trying to do contact tracing on top of everything else that they have to do, our systems internally in the school system start breaking down. And if masks keep that from happening, or even just slow it down to give us time and to keep students there, and to have so many students out that you have to reteach content because you have half of your class gone, we're not moving learning forward if we can't do that. And so that's kind of been a big piece of me as I've been kind of thinking about this decision since our last board meeting, is yes, absolutely, it's about, we gotta keep kids in school, but it's also about how can we keep our systems in place. And if catching everybody in quarantine and if masks keep us from catching people in quarantine, and our systems are strong, I think that is just something that we have to do.
Thank you, Joanna. Kevin?
Well, I guess all I could say is I could echo everybody else's comments there. I agree with all of that. The quarantine piece is a major issue with this because it can encompass so much more, students and staff. Once you take any of those pieces away from it, then we start having issues with being able to keep schools open. So the quarantine, if it would help, if nothing else, but to help with being able to keep kids there and out of quarantine.
Just don't quarantine them. Only keep kids home that are sick.
Yes, yes. Take temperatures.
Can we not, who can change the rules on quarantine?
Hold on, we're still having our
Your
discussion.
time's up. Our decision has got to be data driven, and I agree. 2 months ago, the data looked like the numbers were down. We were gonna be able to handle any outbreaks we had because we were seeing lower numbers. And so, then yes, we want to start removing those restrictions and trying to get back to normal. I thought we were there 2 months ago. To be honest, I thought a month ago we were there. But the data now tells us we're not. And what I'm reading is there's some people out there saying that we may come out of this short, they're calling it, what are they calling it, an ice pick maybe effect this one may have, this surge, that it's gonna be very quick and drop very quickly, from my lips to God's ears, that be true. And in a short amount of time, we're gonna see a very different side of this and be able to revisit the issue.
And we don't have any control over the quarantine rules and all that's right? No.
Kevin, were you able to finish your discussion?
Yeah.
Are you sure?
Yep.
Okay, okay. All right, thank you. Billy, would you like to speak and say a few things?
Most recently, we've got 700 backlog cases in our community. So thinking about it just in terms of that, there's 700 cases out there that are confirmed positives. Of those 700 cases, there's been no contact tracing that I'm aware of that's been done for any of it. So all the people connected to those 700 cases are also out there. To take masks away from that, my family experienced it this over break. It hit our household, and we got a call. Oh, by the way, you're positive, after we were basically out of quarantine. So I believe in responsible citizenry, and I think it's important to be a good neighbor and a good member of your community. And so, I'm not a doctor, but I listen to our local doctors and I listen to what they tell us about what's important and what they would advise us to do. And with that said, you know, we followed the rules that we knew were in place, and the unfortunate thing is I think we've seen enough examples of folks that don't. That's concerning, that there are people that are willing to put others in danger because they feel like their advice is better than somebody else's. So I think that's some important information to be thinking about and considering when we're really looking at this. The case numbers right now are, I mean, we're not immune to this. Scott County's not immune to this. We're seeing what everybody else is seeing. It's just now getting here as far as the cases. And again, my focus has been on keeping school open. You know, today we were out for weather. It wasn't a far cry from it being because of staffing as well. Staffing is getting tight. It's getting tight. So anything, I don't know why we would take anything that we could possibly do that may possibly help away from us in our arsenal as we try to get through this tough period.
Thank you. Yeah, I want to say one thing. So, you know, a lot of times when we're talking about every year, at some point, I don't remember when it is, we have this long list of contracts that we approve, right? And it's with all the people that provide mental health services to our students, right? And it's a laundry list. And we always refer to that as, and Tina Durham, I know, could speak to this, but we refer to that as the basket of tools that we can go to help every student, whatever it is. We try to have as many professional people on contract with Scott County Schools so that we have as many things as possible where we can send students to get help. So if we look at it from that perspective, why are we not doing everything possible to keep students in place? And masking is one piece, one tool in that basket of the many things that we're doing.
I'd like to add in, you know, my fellow board members have discussed a few different things, and I'd like to also add in, we do have the responsibility as school board members to make decisions. We lean in, and I've heard this said a few times, where why are we trusting the government? But I do want to say to you, during this whole pandemic, we have leaned into our professionals that are here locally and regionally. We've listened to things statewide, nationwide, but what we look at closely is what takes place here in Scott County. And I'm not a doctor and I'm not a scientist. So I lean into people who are the experts and people who I respect, and that I feel if I ask them, they're the ones that are down in the trenches working, and I ask for their opinions and what's going on. I know Mr. Parker does the same thing, and I believe our other school board members do as well. But that's what I allow to guide me and guide what I'm doing in whatever area that we're taking a look at. This is a risk management issue. We have 9,000 to 10,000 kids that are our responsibility. We have anywhere between 1,200 to 1,500 staff members that are our responsibility and that lean into us to help us, that count on us on trying to make the right decisions. And this is a daunting task over these past couple of years. And it's not easy. But what I will tell you is that Dr. Hub and Mr. Parker have asked for numbers to be reported to us. We work closely with our local health officials to get numbers on what our daily cases are that we just started posting this year. And those are the kind of numbers that we watch. One child could close down our school walking in exposed and walking into 6 classes in high school without a mask on. And one of the things that we were most excited about this past summer and listening this past spring was how hard our staff and our administration worked all together for a recovery program. Because we were so excited that we could get our kids back into the buildings, which was what we all wanted to do. The mental health calls that I received last year were just horrible. with parents calling and crying about the state of affairs with their children being at home all day long. Those types of calls are very, very difficult. Do I know that masks work? I feel that, I honestly feel, regardless, that if this is yet another tool that we can use to help us along with whatever else your decisions are for your families, then so be it. But I know what our numbers are. I know what our numbers come in with the quarantines versus if we didn't have them, versus if we didn't have the mask, if we weren't watching the quarantines. So as a risk management in order to get our kids into the buildings every day, I too am willing to say, let's wear these masks a little bit longer. Hopefully Omicron will play its course, and here soon we can have a different conversation as we thought we were going to have back in November and December. So I just wanna add that in, as to what my thoughts are. Does anybody have anything else they'd like to talk about?
Motion pursuant to HB SB 1 to continue the masking plan approved by the board on September 16, 2021, with all other provisions of the board's September 16, 2021 actions taken pursuant to House Bill Senate Bill 1 to remain in effect, including its actions on remote instruction, test and stay plans, quarantining, and curfew.
Second.
All in favor? Those opposed? Motion carries. We will remain in masks.
Motion to adjourn.
And number 8, motion to adjourn. All in favor? Those opposed? Motion carries. Thank you, everybody, for joining us this evening.